Hey guys, I'm Amber Sykes. I am currently pursuing a master's degree in human services counseling with a specialization in crisis and trauma. I've always considered myself a proficient communicator. I genuinely enjoy listening to people discuss their problems, their thoughts, concerns. Um, Before this class, I thought I was very active as a communicator, but since taking this class, I've realized that I do have several communication skills that I need to work on. My ultimate goal is to be able to help someone who's experienced crisis and trauma in order to help them regain a happy, normal life. Um, Interpersonal communication would play a very important role in that because in order for me to gain my clients' trust and allow them to feel safe and comfortable with me, I would have to exhibit exceptional communication skills. I would have to be an effective listener. I would need to keep an open mind and listen from my heart in order to remain unjudgmental of what my clients are saying. I need to stay mentally alert, and I will do this by clarifying what they're saying to me and adding to the conversation myself. I need to focus on my clients' ideas and listen with feeling so that they know that I'm truly trying to understand what they're talking about and what they're going through. I also need to exhibit effective nonverbal communication skills. I need to make eye contact with my clients while I'm speaking to them as well as when they're speaking to me. I need to exhibit facial expressions that convey understanding and sympathy. And I also need to exhibit body language that's friendly and comforting toward them so that they are comfortable speaking with me and they know that I understand what they are saying. My professional background, I've actually been working as a nurse for the last 7 years, and this has had a major influence on my communication style. Through nursing, I've learned that I need to show compassion when necessary, but there are also times when I need to show tough love, especially to patients who tend to use the system rather than seek help when needed. A major downfall to my nursing background is that sometimes I get so mixed up with multitasking and trying to get everything done in a timely manner that I'll have patients who just try to have general conversation with me because that's how they find comfort in these difficult times when they're having medical problems. And instead of giving them my full attention during this time, I'm trying to set up a room or I'm trying to get their vital signs, and I'm not really giving them my full attention in order to have a genuine, normal conversation with them. As far as my behavioral blend is concerned, I am an inspirational specialist or a competent inspirational specialist, which was the CIS. This means that I am by nature a people person. I can be very emotional, and I think that people expect me to influence others because of my personal ability to communicate with people. I feel for others and I show genuine concern for them, and I'm motivated to encourage and support others so that they will be motivated as well. This type of behavior blend can be both a blessing and a curse when it comes to communication, because while I am able to listen with genuine concern and I wish to motivate people and encourage them, I'm also very emotional. So this can kind of blur the lines between helping people and them being emotionally invested in what they're going through, which can make it hard to remain professional in certain situations. One of my biggest communication barriers is honestly my own self-confidence. Just like Stuart discussed, when I am communicating with someone, I'm internally asking myself, am I competent enough to help this person? am I a good enough person to be able to help them through this difficult time? And because of my lack of self-confidence, I feel that sometimes I don't communicate to the best of my ability. And I've also noticed that I have a difficult time maintaining eye contact during communication. If I'm speaking directly to a person, I don't have a difficult time maintaining eye contact, but if they're speaking to me, or if there's a silent pause in the communication and they're looking at me, a lot of times I find it difficult to maintain eye contact, and I'll look away, or I'll find something else to give my attention to so that I don't have to keep eye contact with these people. So I think that has a lot to do with my barriers when it comes to communication. I do need to work on this because I fear that this could make my clients feel that I'm not interested in what they're saying, or that I lack the competence needed to help them through whatever crisis or trauma they're dealing with. Some of the most helpful resources that I've found so far are actually the textbooks in our class. Stuart gives an informative text that discusses communication barriers, as well as how to overcome these barriers to become effective communicators. Burley Allen discusses common issues that can hinder effective listening, and he offers the best ways to overcome and become an effective listener. Carbonell discusses the different personality patterns and how they can affect communication. Peterson offers effective communication for talkers and listeners. These texts can be very helpful and informative if the information is used to what it's intended for. We can use these as manuals for our communication. We can use these as sort of a resource if we have questions about how we can communicate better, or how we can listen better, how we can talk better, how we can understand what people are saying, how we can internally speak to ourselves in order to have a better communication style with people, especially in the field that I'm going into with counseling. I need to know how to communicate effectively in order for my clients to be able to communicate with me as well. My action plan: in order to obtain my optimal communication skills, I will first work on my own self-confidence. I want to find ways to reassure myself that I am capable of listening and helping these people, and that I'm a good person and that I'm able to do what I intend to do in my career. I want to focus on my strengths and learn to strengthen my weaknesses. And I'm going to practice my communication skills, especially maintaining eye contact. That's a big must for me. And I want to, my hope is that by working on myself and my communication skills, that I'll be a person that my clients will turn to and seek comfort and support, so that I can make a positive impact on their lives. So in closing, I just want you all to know that I wholeheartedly want to help people. That is my ultimate goal. And I know that there's a lot that I need to work on communication-wise, but I also feel that through this class I have learned some very effective communication skills, and I intend to use those and continue to strive to build my communication skills and understand what people are going through and how they communicate, and the most effective way to communicate back to them so that they feel comfortable in that setting. So I want to thank you all for taking your time to look at this video, and I hope I have inspired others to improve their communication skills so that they can be helpful in the lives of others. Thank you.